Welcome to day 2 of ACOG's 2020 virtual conference and ACOG TV. We have another great show for you today featuring interviews with Dr. Lori Gregg and ACOG's president, Dr. Eva Chalice. We also feature both the AFI Center in Dallas, Texas, and the Center for Maternal Health Equity Research and Training Center at the University of Houston, both of whom are doing great, innovative work in the field. Now to Dr. Gregg, who will be giving us some insight into what physicians can do to cope with burnout. Joining us now is Dr. Lori Gregg. Thank you for joining us. Can you talk a little bit about physician burnout and how it has certainly changed with the COVID-19 pandemic?
Sure. We know that physician burnout is a very important issue. It's been reported that up to 50% of physicians have one of the 3 symptoms of burnout at any one time. The COVID pandemic hasn't done much to help this. In our hospital setting, our self-reported burnout rate is about 25 to 30%. And this year with the COVID pandemic, that's increased by 5 to 10 percentage points. And that's despite a lot of hard work around the issue. The clinicians and physicians that are in the hospital setting seem to be impacted much more significantly than those in the outpatient setting.
Can you talk a little bit about why ACOG thought it was important to have a subcommittee on physician wellness within the Committee on Patient Safety and Quality Improvement?
We know that physician wellness and the quality of care and safety that a physician renders are linked. There are studies showing that physicians and trainees who report burnout have higher medical errors. We know that physicians who are burned out have patient satisfaction scores that are lower. And we see studies that demonstrate that physicians who are burned out are actually less effective within a medical team. We also know that burnout may lead to depression and departure from the medical field. So it's easy to see why committees that involve patient safety, quality of care, and access to care can actually be linked and intertwined with physician wellness committees. In California, I always like to remind those that our physician wellness committee birthed our patient safety committee.
And finally, what recommendations do you have for physicians?
So really, I'd like physicians to remember the 80-20 rule when it comes to physician wellness. That if a physician is burned out, 80% of that is because of the medical system they work within and the inefficiency, inadequacies, and burdens that system carries. 20% of burnout is really under a physician's control, really their attention to self-care. So that being said, if we had the most bang for our buck, we would fix the system, but those system issues are large and complex. And certainly we're all happy to know that there are those that are working on those system issues. Stated another way, burnout isn't a physician's fault, but we can impact 20% of that burnout by paying attention to self-care. We know that studies show that we can increase our resilience and wellness by finding gratitude in the things that we do every day in medicine, regulating our balance between work and our outside life, or integrating that work-life balance, regular exercise, and then again, practicing gratitude, positive reframing, and mindfulness. So in that light, I'd like to express my gratitude to all of those working in the medical field to care for patients during this challenging time.
Dr. Gregg, thank you so much for joining us. Some great recommendations there from Dr. Gregg. Now to the AFI Center, where they are on a mission to help Black women and girls by transforming their relationship with their sexual and reproductive health through addressing the consequences of reproduction oppression.
The main mission of the AFI Center is to positively impact and transform the relationship of Black women with our bodies and sexual reproductive health, to foster complete mental, physical, and spiritual wholeness, one that is grounded in absolute autonomy and free of reproductive oppression. When we founded this organization, HIV was rampant. It seemed like nobody was talking about Black women. When I looked at the data, it was like in Texas, Black women were disproportionately impacted with HIV, but there were no programs. There were no real programs. That was problematic for me. It was problematic for the co-founder. We founded this organization using a social justice and a human rights lens because we know that if we could change the systems that women were living in, the behavior would automatically change. Our vision statement is just very simple, that we are working to end reproductive oppression for all women.
Incredible work there at the AFI Center. Now to the Maternal Health Equity Research and Training Center, where they are working to improve the health of families and improve maternal mortality rates.
We have the highest maternal mortality rate out of all industrialized countries, and Black women are suffering the brunt of that with disproportionately higher death and morbidity rates. We also have about 1 in 9 women experiencing perinatal mood disorders such as depression, anxiety, and OCD.
The community needs a program like Healthy Start because our program goes into homes of individuals and works with the family as a whole, with moms, fathers, babies, and we connect them to services.
Well, the mission of the center is to improve the health of mothers and their families through interdisciplinary research and training. So we're really hoping that by bringing the community into our conversations as well as different disciplines, we can come up with creative solutions to meet mothers where they are and help improve health.
And now, over to ACOG's president, Dr. Eva Chalice, for an overview of her presidential initiative and the formation of the Presidential Task Force. We are now joined by Dr. Eva Chalice, president of ACOG. Dr. Chalice, thank you for your time today. Dr. Chalice, how can OBGYNs improve women's health?
I think that all of us are very interested in making sure that women have access to health care in the first place. Beyond that, we want to make sure we close the gaps in healthcare that women are receiving. There is significant documentation in the literature of gaps that women experience when they receive their care, and we need to make sure that we are the physicians who help close those gaps.
Can you tell me how the American College of Obstetricians and Gynecologists is continuing to focus on preventative care for women?
The American College of OBGYNs is very involved in Women's Preventive Services Task Force and its initiative. The preventive services are something that we feel very passionately about because we know that disease prevention is something that improves quality of life as well as duration of life. So we're very involved on that front in the consortium that is leading the way on preventive services. In addition, my presidential initiative will expand on that role by also identifying opportunities for OBGYNs to close the gaps in women's health care and to really mitigate development of some of the conditions that women face, such as heart disease, obesity, hypertension, diabetes, and others.
Can you talk a little bit about the goals of the newly formed Presidential Task Force and ACOG's objectives for 2021?
So in order to achieve the presidential initiative goals, we have formed a task force that's led by Chair Dr. Mary Roser and co-chair Dr. Katie McHugh. They're in charge of a large number of very talented individuals, physicians, as well as staff, who are helping develop basically a blueprint for OBGYNs to be able to enhance the kind of care we deliver to our patients well beyond checking their pelvises and delivering gynecologic and obstetrical care. This is really important in order to be able to close the gaps in women's health care. And so we're hoping that with additional use of technology and strategies to implement this blueprint, our physicians will be able to provide better and more comprehensive health care to women. We are uniquely positioned as women's health specialists to be able to identify early disease, such as pregnancy-induced hypertension, gestational diabetes, issues of obesity, and so on, and potentially offer mitigating strategies that will help our women stay healthy and live good, long, productive lives.
Dr. Chalice, thank you so much for your time today. That's it for the second day of ACOG TV, but there are more incredible sessions to tune into as we come to the last half of ACOG's 2020 virtual conference. Make sure to check out the full-length versions of each of the featured films for a deeper dive into their amazing work. Thanks again for tuning in and enjoy the rest of the conference.